Why do you train? This is vaguely about motivation, but I'm not a big believer in motivation. I think that motivation is fleeting. Lots of people are motivated and then it drops off. We all know this, and I don't need to be another voice out there telling you that discipline always beats motivation, because if it's about you doing the things that you don't want to. I also think that it's important to have a reason why you do things, though. And I feel like that's actually still different than just simply motivation. There are going to be times where you don't feel like doing something, but you're going to do it because you have a why, not just simply out of discipline. I'm not so amazingly disciplined that I always do the right thing or something. No. And I'm also not motivated. There are plenty of times where I just don't fucking feel like it. So why do I do it? Because I have a why. Because there's a reason at the end. So I was thinking about this and I thought to myself, if you knew that you would never hit another PR ever again for the rest of your life, would you continue to train? If you knew that you would never reach your goal physique, your goal level of strength, your goal level of performance, if you knew that you would never reach your goal, would you continue to train? If, for instance, hypothetically, you were 38 years old and you happen to hit a PR in the last 10 years, not like I know anyone like that, would you continue to train? I always find it weird when people say things like, I'm 40 and I'm in the best shape of my life. And I'm like, what did you do in your 20s? I peaked somewhere between 25 to 28. That was my peak. And it's called a peak for a reason, because that is the highest level that you achieve. And everything after that is downhill. It's kind of like people that step on stage. It's like, this is the leanest that you'll ever be, and anything else is, well, not. Right? It's like if you were to squat 1,000 pounds, and then, I don't know, like pretty much everything after that, you just start going backwards because maybe you're 35 years old and your body's beat up and it took so much out of you. Maybe you won a Stanley Cup. Maybe you won a boxing championship. Maybe you're the world champion. And then, how long can you stay the world champion before you start losing fights? You're undefeated, you win the world championship, and at some point you lose, and, well, that was the peak of your career. It starts going down, right? Would you continue to train? For me, my reason is really quite simple. I'm not shy about this. I tell people I'm not healthy. I got hit by a drunk driver. I've been dealing with health problems ever since. Please spare me your bullshit about it's being, it's because you're not vegan, or it's because you're not this or not that. Listen, it has nothing to do with diet, man. Sometimes you get just bad fucking luck. Okay? Got hit by a drunk driver, had a hemorrhage in my brain, did a whole bunch of damage to my body. My kidneys are fucked up. I got all kinds of problems from it now. Joint problems, bone problems. You can't undo that. You can't tell me that somehow following a whatever keto diet or carnivore diet or paleo diet or vegan diet or whatever would magically make bones not break when you get hit by a car. That doesn't work that way, folks. So, why do I continue to train? Why do I continue to try even though I'm going backwards? I'm very much going backwards. I'll never hit the numbers that I hit when I was in my 20s. I'll never even come close. The reason why I continue to train is because my doctors encourage me. My doctors have told me that they never have, now I'm not saying I'm the only person to ever survive this. I'm saying my doctors say they have never seen someone survive it. So just because they haven't seen another person survive it doesn't mean that someone else isn't out there that survived it as well. But personally, on a personal level, the doctors that I saw told me they've never seen someone survive the type of injury that I had. I'm sure someone else has. I'm sure their doctor told them. I haven't seen another patient that survived it. That doesn't mean that there aren't other patients out there that have survived it. It's just that it's not common. It's not like you see this every day. So my doctors told me that I was very lucky to be alive, and that the fact that I was so fit is likely the reason why I survived. And when I had the adrenal crisis, again, I was told by my doctors the fact that I was so fit was the reason why I survived. My doctors continually encouraged me to keep exercising, to keep taking care of myself, to keep eating well. My doctors have repeatedly told me that they believe that my dedication and my consistency, my efforts to at least try to be healthy, my efforts to exercise and eat well, are the reason why I have not deteriorated as fast as they even predicted. At one point in time, I was told that my kidneys would be done in about 3 months. Well, that was 2014. August 2014, I had a nephrologist tell me I had about 3 months left on my kidneys before I'd need either dialysis or a transplant. Here we are, it's 2022. I'm still not on dialysis, and I don't need a transplant right now. So much for that 3-month prediction. I'm sure that for a normal person, probably would have been 3 months, but I have been very proactive. I'm big on preventative care. I'm big on taking care of myself. And so I'm able to delay those things. It's no different than when I've been told by doctors, oh, you're going to need a hip replacement in a year or two. And here we are, and it's like another 5 years later, and I still don't need a hip replacement. For me, I don't really care if I ever squat 500 pounds. I don't. And I'm not trying to clean and jerk double body weight. What I'm trying to do is I'm trying to delay things like needing a hip replacement. I'm trying to delay things like needing a kidney, delay dialysis, delay the decline that comes with age. My why is because my doctors keep telling me that the things I'm doing are the reason why I'm still going. I've been told by doctors flat out that if I wasn't so careful about what I eat, or so careful about my hydration, or so diligent about being consistent with my exercise and things like that, or so careful about my sleep even, that I certainly would have deteriorated by now. That's a hard thing for me to say, actually, because it makes me recognize that actually I will deteriorate eventually. I'm just slowing it down. And that's fine. That's actually certainly beats the alternative. Okay? I know, we want to believe that everything can be fixed. And the truth is that sometimes things happen to you that can't be fixed. There's no undoing certain things. I wish there was. If you have a severe enough brain injury, there's no amount of drugs or interventions that will undo that. And similarly, I could show you all my scars and tell you that once you cut into the body, it doesn't ever feel the same. It's like, oh, well, we went in and did this thing to your knee, and it's like, it doesn't feel like it did before. Cut into your abdomen. They cut through my abdominal wall. That does not feel the same. It's never going to feel the same. Once they cut through your abdominal wall, it does not feel the same. You want it to. You're like, man, I hope it feels the same after they're done. But it doesn't. Maybe someone out there has a great story. I got my hip replaced. It feels even better than it did before. Maybe. But for me, no. So I continue to be diligent. I continue to make the effort. Not because I'm motivated. Not even because I'm disciplined. It's because I have this moment where I was like, I really don't want to do this thing. And then I remind myself that if I do this thing, and I do it anyways, it's one more day that I've bought myself. And it's one more, penny in the bank, or whatever you want to call it. It's one more deposit where I'm buying myself a little more time. And that's my reason for training. It's because I've survived some shit that I probably shouldn't have. And the only reason I survived it is because I was fit enough that, blood loss and whatever other shit happened to me, I pulled through it despite. It's like the time I rolled into the emergency room with pneumonia that was so bad that they were looking at my pulse ox and they were like, how are you even conscious right now? And it's like, I don't know. Mind you, I was like 28 at the time. I was very young. I was very healthy. And I couldn't understand even what they were trying to explain to me because I was half out of it. But apparently I had pneumonia that was so bad that my pulse ox was below the normal level that people would lose consciousness. And here I was with this extremely low pulse ox. And I'm like, I don't know how I'm still conscious. I drove myself here. I'm at the emergency room in Tampa. I'm like, I don't know how I'm conscious. Just make this stop because I can't breathe. Feels like I have an elephant sitting on my chest. Apparently a normal person would have lost consciousness and probably not driven themselves to the emergency room. But you buy yourself a lot of wiggle room if you take care of yourself. You'll survive things that you probably shouldn't have. And that's my reason for training. I'm not trying to win anything. I'm not trying to set records. I'm not trying to impress people. I'm not trying to get a following on the internet for being the strongest dude. I do what I do because it buys me time. That's my reason. Comment below. What's your reason? Why do you train? What are you focused on? Are you doing it because you want to be around for your kids when you're 70? Are you doing it because you are trying to set a goal? Maybe you have some record you want to set. Maybe you're doing it because you're in the military and you need to be fit in order to be a good teammate. Maybe you have some other reason. Comment below. If you guys like the video, you watched like 12 minutes of it, and subscribe. We can talk about these things even more, especially we can talk about things like chronic conditions, chronic illnesses, and how you can continue to train or exercise or continue some type of fitness endeavor alongside of your condition, and how you can do things to kind of balance it. Because I certainly have days where things are so bad that I can't do much, and yet I still find some way to do something that will be productive. And that's actually something I should probably talk about more, is the days where I really can't do hardly anything at all, and what I do on those days instead. Maybe I'll make a separate video discussing that. So subscribe if you're interested in that kind of content. Comment below if you're interested in that, and we can certainly dive deep into it.